Playing cricket for India has not only earned me admiration from the people of this great country, but also taught me a lot about life. Be it a test match or one's own health, it's important to know which deliveries to play at and which ones to leave alone. Hello, I am VVS Laxman and you will be seeing me in a different role today. I am pleased to be here with Dr. Supriya, an expert in diabetes and insulin management. Insulin, while important to many diabetes patients, is unfortunately surrounded by misconception which patients can often fall prey to, keeping them away from living the healthiest life they can with diabetes. The purpose of this initiative is to ensure that Indian diabetic patients do not get caught behind by playing an outswinger of misconception and rumors about insulin therapy. Doctor, my first question to you is, patients often feel that insulin injections are going to be painful. Is there any truth about this? How would you reassure a patient of yours who has this fear?
Yeah, thank you Lakshman for asking this question, because it's very commonly asked question by the patients. And this pain and the fear of needles, it is one of the commonest limiting factor because of which patients are usually reluctant for going for the insulin injection. But the fact is that this insulin devices and the type of insulin, it has traveled a very long distance now. Initially we used to have insulin vials, that is bottles and syringes, but now we have a pen devices which is very user friendly, very patient friendly. And this pen devices, actually it comes this pen form, and there is a cap. It is just like a writing pen and it has a cap and there is a needle inside. This needle, it's very small and very thin, so it is very practically painless. And if patient follows certain things, like if they change the needles regularly, or if they keep the keep on rotating the site of injection, the pain and the discomfort because of the injection, it minimizes very significantly. So practically we say that if these pen devices are truly painless.
Thank you. Doctor, my second question is, a patient may be nervous about the social stigma surrounding insulin, like taking an injection in public, or may believe that needing insulin is a personal failure of theirs. What would you tell to such a patient?
Yeah, again this is a very important question. There is a stigma associated with diabetes and specifically with the insulin, because people are very hesitant of taking the insulin injections in the public places. But there is always a way out. These pen devices, these are very easy to carry, very convenient to carry with the patients in the bag. And if somebody is attending a family function or say party, then he or she can just go to another room, or for that matter washroom. They can inject the insulins and come back and resume the function again. So this is definitely a way out. But I would say if the patient accept that they need insulin for the better and the smooth control of diabetes, so they respond to the treatment very well and they become more confident about diabetic management. So it is better that they accept the insulin usages. And for this we definitely need a repeated counseling. Many of the times what happens is that before initiating the insulins, we have to counsel them in 1 to 2 visits, then we initiate with the insulin maybe in the 3rd visit or so. And at subsequent visits also we have to counsel them regularly about the insulin benefits. And believe me, many patients, when they are started on the insulin, they are very comfortable and they want to continue with the insulin. They become more comfortable because the good sugar control is achieved, it is very smooth, and they have a very minimal side effects also because of insulin. So definitely acceptance is good if we counsel them. But yes, definitely counseling is needed to come out of the stigma and to have a good acceptance for insulin.
Thank you. Doctor, my final question to you is, people might believe that needing insulin means they can no longer be independent, eat out, travel, or live alone. Would you say there is any truth to this?
Yeah, again a very important question, because there are a lot of myths associated with diabetes. Specifically if we talk about the insulin, many misconceptions are there. People think that if the insulin is initiated, it is a kind of terminal stage of diabetes, or it's a kind of advanced stage of diabetes, or if it is started, it will be there lifelong, or people cannot do any activity. So these are all misconceptions associated with that. but the fact is that the insulin indications are very different level, because many times we just initiate the insulin for a very short period of time. Say the patient undergoes surgery, or if the patient had some critical illness, so we start with the insulin, get the good sugar control, and then we can switch over to tablets also. And many times insulin is initiated even in the early stage of diabetes to achieve a good blood sugar control. So it is not like insulin it started, so it is a kind of very advanced stage of diabetes. Second thing is that if the patients are started on the insulin, they can travel or they can enjoy all the activities, because this pen devices what we just talked about is very easy and very convenient to carry in the bag. Now we don't have to really refrigerate these devices. Once they are in use, we can just carry them in insulated pouches with us. So in traveling it is very easy. Second important thing is that in traveling what happens is that many times the meal timings are changed or the meal patterns are changed, and these insulins also we can adjust the timing of the dose also can be changed as per your meal timing, and the dose also sometimes can be titrated as per your meal pattern. So it's very flexible as per your meal pattern. And second thing is that, so with this insulin, it doesn't cause any restriction on traveling, even if you are going out, or if you want to enjoy any sport activity or any kind of activity. So it doesn't give you any kind of restriction. In fact, it gives you a freedom to enjoy eating out or traveling or enjoying any activities. So definitely it is very, very important in your good sugar control management for the most of the patients. So this is it. Okay. So thank you, Laxman, for interact with me and asking the question, and to spread the awareness about the insulin among the patients. Thank you so much.
Thank you for your time and your input. Dr. Supriya, I'm sure your insights and expertise on insulin therapy will be of tremendous benefit for the millions of diabetic patients living in India. When you're batting with insulin, it's important to avoid the outswinger of misconceptions for a better inning.